Hello everyone and happy February. As we celebrate Valentine's Day this month, it's also important to take time to recognize that February is Heart Health Awareness Month. On today's episode of New England Urgent Care Talks, Dr. Gutman and myself will be talking about how to recognize, treat, and help prevent heart disease, the leading cause of death in the United States.
The month of February is dedicated to raising awareness about disease, increasing knowledge about prevention, and developing a heart-healthy lifestyle. Before we speak about prevention, though, we should define the disease we're trying to prevent.
So why is it important to know about heart disease, Dr. Gutman?
Heart disease is continuing to be the most common reason people die in the United States. It accounts for 1 in 4 or over 600,000 deaths a year. The emotional and financial costs are staggering.
What is the most common heart disease?
By far and away, the most common is ischemic heart or coronary heart disease, which leads to heart attacks. Coronary heart disease is characterized by partial to complete blockage of arterial blood flow to the heart muscles. Before we go on, we should just have a little basic anatomy and physiology lesson here about the heart. The heart is a specialized muscle whose main purpose is to rhythmically propel blood, which it carries oxygen and nutrients throughout the body. The heart itself needs those oxygen and nutrients to function itself. So if the vessel that supplies the heart muscle is blocked, then parts of the organ that aren't getting the oxygen and nutrients die. This is called a heart attack. If sufficient amount of the muscle dies, then the heart no longer has the power to propel the blood flow forward and can lead to heart failure and ultimately death. The area of the dead muscle also becomes what's called an irritant focus that can cause deadly rhythm disturbances that interrupt the heart's ability to coordinate its contractions and propel the blood, again leading to heart failure or death.
Okay, so if your heart vessels get blocked, then do you always get a heart attack and possibly die?
Fortunately, no. That's not always the way it happens. More frequently, the coronary arteries get progressively more clogged with cholesterol plaques and then less and less able to deliver the blood to the heart muscle as it demands. So if a person has one of the blockages that are only narrowing but not completely blocking off the flow of blood to the heart muscle, every time that patient increases demand on the heart, like when they're exercising or if they're having an argument, getting emotionally upset, or eating an overly large meal, they'll get symptoms that eventually go away. If these symptoms are ignored, however, the narrowing of the artery will progress and eventually completely be blocked off, causing a heart attack. So the key is to get early detection of the heart disease before it leads to the heart attack.
All right, and what are some symptoms of coronary heart disease to be looking out for?
The symptom which announces the disease is most usually chest pain. However, there are many other symptoms such as breathlessness, nausea, or feeling very weak and dizzy. The more classical symptoms of ischemic heart disease is chest pain, which comes with exertion and goes away at rest. Not everybody's read the textbook, though, and so they come up with these other symptoms. Those symptoms are called angina. That's when you get the coronary arteries are narrowed but not completely blocked off. However, if that blockage suddenly becomes complete, then the symptoms, be it chest pain, nausea, weakness, or any of the other, or the breathlessness don't resolve after several hours, even with rest, that's probably the heart attack. This is a deadly scenario, and it has to be acted on immediately by the patient seeking medical attention at an appropriate facility, such as the emergency department, or if closer in time, a certified urgent care center, and that's to immediately rule out the possibility that a heart attack is not happening.
Okay, so were you then telling the audience that every time they have chest pain, they should call 911, go to the emergency room, or as soon as possible seek urgent care attention?
Definitely not. Only 3% of chest pain that comes to the emergency department is an acute heart attack, and in fact, less than 2% needs to be there right away or their life is endangered. That less than 2% of chest pain, if they are having what's called an ST elevation, which is an electrocardiographic sign, ECG sign, heart attack, needs to be in the cardiac catheterization lab within minutes so that the interventional cardiologist can open up that vessel and before the heart muscle has a chance to die irreversibly. The bottom line is that 97% of chest pain is not a heart attack, at least initially, and can safely be investigated in a setting outside the emergency department, such as in a certified urgent care. So when I said definitely not the emergency department for all chest pain, yes, but definitely yes to seek medical attention to make sure that the chest pain is not a ischemic heart disease or acute heart attack.
You're safe. It's not a high level of danger. Now, that's twice that you've mentioned certified urgent care as part of the ability to care for acute heart disease. What does certified necessarily mean?
Just because someone puts up urgent care on their awning outside their practice does not necessarily mean that they're certified to do so. In Connecticut, there is no regulation legislating who can put up the sign urgent care. However, if they have Urgent Care Association of America certification, that means that that center has resuscitation equipment as well as the personnel who are trained to take care of acute illness or urgent illnesses and injuries. Urgent care certification infers that they are able to care for a far broader spectrum of illnesses and injuries than centers that do not have certification. New England Urgent Care, which has 3 centers, one in West Hartford, Enfield, and the one which is in the north end of Simsbury, just north of the ice skating rink, is the only one with certification in the Farmington River Valley.
Wow. So that's very interesting and really knowledgeable information that people should have. So New England Urgent Care is certified. So does that mean if one of our audience members watching now in the future feels that they may be having a heart attack, should they go to the urgent care rather than the ER?
That's a tough question. There's no research saying yes or no to that question. It hasn't been addressed. All the studies have certainly suggested that calling 911 is preferable over going to a private doctor's office if you truly are having a heart attack. That research was done before urgent care as a system came onto the scene. And that's on this presumption that the ambulance crew, which with resuscitation equipment and the personnel who are trained in its use, arrive within about 10 minutes of the call to the ambulance. However, I hold the opinion, and like I say, it's opinion, it's not based on research yet, that if a certified urgent care is less time distance away than to wait for an advanced life support ambulance, which in parts of Simsbury and Granbury may be over 20 minutes away, then it's preferable to go to a certified urgent care center, which is equipped with resuscitation equipment and trained personnel. We have seen several patients who have driven to our center with acute heart attacks, in fact, and have had them safely transferred to the cardiac catheterization lab within 45 minutes of arrival at our door. But fortunately, most chest pain sufferers, in fact, are not having heart attacks.
Well, if the chest pain is then not a heart attack, what else could it possibly be?
Alex, it took many years of training and practice in emergency medicine on my and all the providers who work in New England Urgent Care's part to learn what other things could be than a heart attack. So the short time that we have in this program doesn't really allow for a comprehensive recounting of all the possible diagnoses. Suffice it to say that most chest pain is not life-threatening, but it takes a trained medical professional, preferably with emergency medicine background, that has a healthy index of suspicion for those things that could kill you, to evaluate the diagnosis and take appropriate actions. In short, if you have chest pain, go to a health professional to be evaluated. And if you want to be taken seriously, go to a facility that has emergency medicine trained personnel in it.
Thank you for that at least brief answer. At the beginning of the program, you had mentioned a heart-healthy lifestyle. Now, what exactly is that?
A heart-healthy lifestyle is one which you are taking steps that promote overall heart wellness. A great way to further develop this question is to first talk about what are the risks.
So, what are a few of the common risks for heart disease?
Risk factors for heart disease can be divided into two categories, controllable and uncontrollable factors. Uncontrollable factors such as your age and family medical history cannot be changed. So just as in the Alcoholics Anonymous prayer, to paraphrase, give us the wisdom to not worry about the things we can do nothing about, such as family history, and the strength to change those things that we can do something about, namely the controllable factors.
Nicely put. And at what age does one's risk for heart disease become increased?
Well, let me preface this before I said that there are controllable and uncontrollable risk factors. For the uncontrollable risk factors, you should really be aware of them nevertheless, and it's good to know what age your risk factors start increasing. Okay. So for women, the Tiger Country age is 55. After menopause, women are more apt to heart disease in part because their body's production of estrogen drops. Estrogen seems to have some protective properties against heart disease. However, once its production drops after menopause, women catch up to men's risk levels. Men's risks increases after aged 45, a full 10 years. Wow. Before women start getting into the danger zone. However, if any relatives, be it parents, grandparents, more parents and siblings that have had a heart attack at a younger age, let's say in age 40 or 35, then that risk is greater for yourself. Also, if you're a smoker, coupled with other risks, you can lower the heart attack age down to age 35. I would say that the youngest patient I've seen who's had a heart attack with no risk factors is 32.
Which is
the only thing
incredibly
was
young.
They were smoking.
Yeah.
Finally, if you're unwise enough to abuse cocaine, heart attacks can occur in the 20s.
Wow, so there's a lot of things to be aware of in terms of age. Now, what are risk factors that we can control individually?
These factors include smoking tobacco, being physically inactive, eating unhealthy, being overweight, having diabetes, and having unhealthy blood fat levels, cholesterol levels, or blood pressure, high blood pressure.
Now let's talk about some of these risk factors individually. Break them down step by step.
Okay, well, let's start with smoking. Cigarette smoking, even just light amounts. You know, some people say, well, I only smoke 2, 3, 6 cigarettes a day. That still increases the chance of heart disease tremendously. The chemicals in cigarette smoke, even if chewed, are absorbed by the bloodstream and have been shown to accelerate cholesterol plaque formation in the arterial walls.
What is cholesterol plaque?
Cholesterol is a type of fat or lipid that is dissolved in the bloodstream. Certain types of cholesterol are deposited in the wall of the arteries and can lead to the blockage that we talked about earlier.
Is it safe to smoke e-cigarettes or the smokeless kind? I know there's been trends or talks that those are safer, they're not as dangerous.
Okay, relatively speaking, it's a step in the right direction. It is safer. But one of the main ingredients in e-cigarettes is nicotine. And that chemical has been shown to accelerate heart disease. So the e-cigarettes may not cause as many respiratory complications as does tobacco smoking, such as emphysema and lung cancer. They still are dangerous with respect to heart disease.
Okay, so it's not necessarily, it's safer, but really not as safe as not smoking. And you mentioned cholesterol and blood fat. What can you do to lower those risks?
Cholesterol is a fat dissolved in the bloodstream and can be measured. There are different kinds of cholesterol. The low-density cholesterol, sometimes called the bad guy cholesterol, is the one that should be controlled. The best way to do so is to restrict animal fat ingestion and maintain a diet low in polyunsaturated fats. However, if despite this the cholesterol is elevated, the patient needs to go on medications to lower its levels.
So what other risks should we then be concerned about?
Aside from smoking, another cardiac risk for which is closely linked or correlated to is diabetes. Now, there are two types of diabetes: juvenile, also known as type 1, and adult onset, which is known as type 2. The best you can do to control the risks of juvenile or type 1 diabetes is to be careful about your sugar control, your blood glucose control, by eating a proper diet and taking adequate amounts of insulin. Adult onset diabetes is more complicated. Adult onset diabetes is not due to a lack of insulin like juvenile diabetes, but rather insensitivity to insulin. The insensitivity to insulin is almost invariably linked to being overweight. In fact, type 2 diabetics have an overabundance of insulin. Because the pancreas, which produces this hormone, is secreting more and more of it to try and lower the elevated blood sugar that it's detecting. The increased levels of insulin are not successful in lowering the blood sugar, but are successful in affecting fat metabolism, though not necessarily in a good way. Insulin is one of the only hormones the body secretes that results in energy storage. We store whatever extra food energy we have in our body mostly as fat. Thus, though the insulin is not particularly good in controlling the blood sugar in adult onset diabetes, it is good in storing the extra food energy as fat. This results in the person getting more obese and elevating other fats such as cholesterol in the bloodstream. As we've already discussed, the elevated cholesterol increases the risk of coronary artery disease. But even if there is not elevated cholesterol, the diabetes is directly linked to the increased risk because it affects the small blood vessels and decreases the ability to circulate blood to all tissue, leading to problems called peripheral vascular disease, let alone coronary artery disease.
Wow, that diabetes problem definitely sounds almost impossible to control. What can be done about it?
For adult onset or type 2 diabetes, there are multiple approaches. It's not impossible to treat. Initially, once detected, if severe enough, there are medications available that can increase the body's own insulin sensitivity. The most current recommendations are that if that approach fails, the patients should be put on insulin. I really dislike that approach because I feel that only it contributes to the problem by increasing the patient's fat deposition and leading to even more insensitivity. Ideally, though, the more important, and if I may add, curative approach is to lose weight. Of course, this is easier said than done. However, if you can meet with a nutritionist and exercise regularly, it is very achievable.
Okay, now what if you are solely obese and not diabetic? Is that dangerous necessarily in respect to heart disease?
First, let's define what is obesity. A person is obese if they're 20% greater than their ideal body weight. And that's based on their height and their overall body habitus. Obesity in several studies has been found to be a risk factor for coronary artery disease independent of diabetes or hypertension, which often coexist in people who are overweight.
Now, you've mentioned hypertension several times during our discussion. Could you elaborate a little bit more on what that means?
Hypertension is often called the silent killer. First, let's define it. Hypertension or high blood pressure is defined as a recurrent measurement greater than 140/90. The first or top number, the 140, is the systolic blood pressure, and the bottom is the diastolic pressure.
Okay.
Many people walk around with numbers that are well above that, but they have no symptoms and are unaware of them. However, what happens is that hypertension works slowly on the blood vessels that supply the vital organs, namely the heart, the brain, and the kidneys. If there's chronic hypertension accompanied by elevated cholesterol, then the increased force on the blood blood vessel walls due to hypertension results in accelerated plaque deposition, that cholesterol plaque that blocks out the vessels. Just to review, if these cholesterol plaques that narrow the artery walls, they cut off the flow of oxygen and nutrients to the tissue that they supply. If that tissue is the heart, then coronary artery disease results. If the brain is affected, then strokes happen. And if it's the kidney, then kidney failure occurs.
Okay.
Additionally, with respect to the heart, hypertension also leads to thickening of the heart muscle. Just like a weightlifter bulking up if they're using heavy weights, the problem is that the heart muscle is supplied by coronary arteries from the outside in. The nutrients and oxygen go from the outside of the heart and
work their way
into the chambers. So the thicker the heart muscle, the less oxygen and nutrients reach the most inner layer of the heart muscle. So if the heart muscle gets too thick, as it does with chronic hypertension, it's more prone to ischemic heart disease.
Okay, what can be done about this hypertension?
Hypertension, along with smoking, diabetes, hypercholesteremia, obesity, is a controllable and reversible risk factor. Diet and regular exercise certainly plays a role in preventing hypertension. If that fails or if it's not achievable, then there are medications that can control blood pressure.
Now, today we've discussed a lot of risk factors and ways of managing them. Where should our audience members go then if they seriously are considering ways to help and deal with these life-threatening issues?
Ideally, the patient should go to their established primary care physician to manage these risk factors. However, if you do not have a primary care physician or cannot get to see them in a timely fashion, then New England Urgent Care can certainly evaluate and treat these problems. Not only are we capable of diagnosing and treating the outcomes of not controlling the risk factors, we can also initiate the usual Western or allopathic medical treatment. In addition, we've developed a complementary medical approach, which we will elaborate on in future programming, hopefully next month. Though, in the meantime, feel free to, any of our audience members calling our Simsbury Clinic to find out more about these services which are already in place and established.
Of course. A lot of this information can be overwhelming and even seem scary. But what our folks watching out there should know that there's a lot of simple steps that you can take to not necessarily reverse, but help prevent heart disease in the future.
Exactly. And that leads us back to your original question. What is heart-healthy lifestyle? That is one that includes preventative measures such as stop smoking, exercising regularly, getting regular screenings of cholesterol levels, blood pressure, and diabetes, and adhering to a heart-healthy diet. But even despite our best efforts, we still succumb to illnesses and injuries. So if that is the case, New England Urgent Care is certainly available to minister to your acute health needs.
Well, thank you, Dr. Gutman. Now, are there any resources that you could possibly point our audience members to if they want to research up more on heart disease themselves?
The information that we discussed today can be found on our website, urgentcarenewengland.com, but also at the Center for Disease Control online and myamericanheart.org. Of course, the internet is a huge resource in general, and entering search items such as heart attack and heart disease prevention in Google will give you a wealth of information. But please, don't mistake your ability to read information on the internet as having a full understanding of the subject. I went to school for 17 years after high school, have been practicing medicine for over 25 years, and I'm still learning. Certainly prepare yourselves with figuring out what the right questions to ask, but do go to a medical professional to guide you through the immense amount and sometimes confusing knowledge.
Well, thank you again, Dr. Gutman, for sharing your expertise. And for all of you watching, thank you again for tuning in, and we're wishing you a very heart-healthy February.
I'm Dr. Gutman.
And I'm Alex Almeida. Thank you for tuning in.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.